welcome to another episode of Purvis Versus. My name is Eric Purvis. I'm a massage therapist, course creator, continuing education provider, curriculum advisor, and advocate for evidence-based massage therapy. In this episode, we welcome Nadine Harlock, who is an RMT in Courtenay, BC. She tells us about her journey into academia and the valuable education and insight she gained while completing her master's degree in applied science. The focus of our conversation is on the new CMTBC's new standard of practice on evidence-based practice and how we think this could potentially shape the profession in BC. If you enjoyed this episode, please rate it and share it on all your favorite social media platforms. Purvis Versus can also be found on YouTube, so please check us out there and subscribe. So thanks for being here, and I hope you enjoy this episode. Welcome to another episode of Purvis Versus. Today we have Nadine Harlock. And she just told me how to pronounce her name, so hopefully I got that right. She lives in Courtenay, and I'm excited to have you here. We're going to talk about, many things, but we're going to talk a little bit about kind of the focus is going to be on evidence-based practice and kind of what that means for the profession of massage therapy. And we did talk offline about kind of some of the 10 tenets of evidence-based practice. So it's going to be fun and exciting for us to break this down a little bit. But before we get started, just tell everyone a little bit more you. Who is Nadine?
Oh, that's a big question. Well, professionally, I've been an RMT since 2017. But before that, I was working in spas and sort of other sort of practices being a body worker since 2011 when I graduated from a shiatsu program at Langara College many moons ago. And currently I'm running a private practice in Courtenay here. And Courtenay's awesome. Personally, I love the outdoors. I ski, paddleboard, that kind of thing. And if I can get out to a trivia night and host a murder mystery party, that's my jam too. So,
what kind of trivia do you like?
Oh, well, I mean, I do best with like sciencey stuff. Usually I'm that person at the table. So yeah.
I love Trivial Pursuit and I love like just random stupid trivia. My brain seems to not remember important things like what I need to do from day to day, but I can remember useless facts from an 80s TV show or something. It's ridiculous.
Yeah, it's good fun though.
I love trivia. I always in my younger days we used to do a lot of like music bingo trivia. I don't know if that's something you ever were into.
No, music for some reason doesn't stick. Yeah.
Oh, okay.
Yeah.
My previous life, I was heavily involved in music, so for me, it's something that I love. So
Yeah.
So I don't think I knew that you were involved in like I didn't realize that you did like body work before you became a massage therapist.
Oh yeah.
What was the reason for going from an unlicensed body worker to getting your license as an RMT?
I had worked in some big spa, well, one big spa in Whistler, and I think it was really just recognizing like it was a bit of a slog being unregulated, getting enough hours, getting enough work, and just seeing RMTs were booked solid. And I needed to live. So that was a big push. And I think I also noticed when I was working with people, like they'd be asking me questions and I didn't really know how to answer them properly. So it was kind of, I was just ready to sort of grow in that profession and learn more and become more of an expert in that realm. So
Nice. So did you go back to Langara then to do your RMT degree or your RMT? Sorry.
No, I moved out to Victoria for WCCMT.
Oh, I didn't. Okay, see, I'm learning all kinds of things. I didn't realize that. Okay, so you went to WCCMT here. That's where I went to school as well, but I think
Oh,
probably
okay.
well before you. So we've connected before because I think you've taken some courses of mine and we've chatted kind of just for email over the last few years. But you recently completed your master's degree. Is that correct?
Yeah.
Tell everyone a little bit more about that experience and kind of what you learned or what you focused on learning on.
Yeah, so I, in August, actually wrapped up my master's in clinical science at Western University, which was an awesome program. It was online. If anyone's sort of interested in looking at programs that might fit in well with working full time, it was an awesome program. And it sort of focused on sort of becoming a leader in healthcare. And I definitely chose the leadership focus. So we really like the foundation of that program was one, evidence-based care, learning how to appraise research, and critical thinking. Everyone had to take a critical thinking course as well. So, and then beyond that, I chose the leadership stream and got into um, program evaluation and implementation science, which was really interesting. I didn't realize that was a branch of science. That's sort of a newer field, and I think it's super applicable. Of being like, how do we get new practices into into healthcare and what makes them catch on, and what the barriers are there. So,
That sounds really fascinating.
mhm.
It sounds something that's could be hopefully appealing to RMTs, because as far as I know, there's only really two programs that you could do like distance wise for massage therapy and get a master's degree in something that is could keep you still within the profession,
Mhm.
right? And one's the program I did at UBC, the rehab science, and I think there's also McMaster has a rehab science. I think they actually are the same program, just different universities. And then you were at Western with the applied science,
Mhm.
and I think Western has quite a few different options within that.
Yeah.
Because I've done some mentoring, clinical mentoring with students who are RMTs through Western, but they weren't doing the applied science. I don't, or they were, but they were doing maybe something else. I'm not sure what the other program is there, and I'm just kind of
Mm.
spitting words out without making any sense right now.
Yeah, they've got a few different options, and I know Susan Shipton did her
Yeah,
program there, and that was really focused on pain, um, multi sort of all the approaches to pain.
yeah,
Um,
that's what it was.
yeah, and so it's this one is like a similar branch but off. So there's just so many options. If you're depending what you're really interested in, there's an option for you.
Nice. That's right. Yeah, Susan, I remember it was a few years ago when she did that, and yeah, it was the multidisciplinary pain management. I think was
Yes,
kind of
that's
the
right.
focus,
Yeah.
which was seemed like a really cool program as well. So I think it's great because you and I obviously are going to come from the same, probably a lot of the same beliefs about the ways to advance the profession and to become, I don't know, more recognized or more accepted within kind of the academic fields, to advance the practices and the research. Is we need more people with graduate level education. And what's nice is that there is some of these other options available for you. The only problem, though, I think that a lot of people run into is you have to have a bachelor's degree first, right?
Yeah.
And you had a bachelor's first, I'm assuming.
Yes.
Yeah.
Yeah. Yeah. I had an undergrad in zoology. Yeah.
Right. Yeah.
Yeah.
Yeah. Yeah, so that's the thing too, is that's one of the things that's unfortunate about our profession is because it is just a diploma. If you wanted to go and do more advanced education, you basically we'd have to go back and do an undergrad and then go into it. So it's not available. It's not something that's an option for everyone. And it's obviously something that not a lot of people don't want. But
Yeah.
over the years, I have noticed that there's a lot more RMTs getting master's degrees now than there was when I started practicing almost 20 years ago. So that's encouraging. Fingers crossed. Hopefully that keeps going.
Yeah, yeah. It seems like, after some time you've been in the field and there's something that says, hey, maybe I want to grow and learn some new stuff. So I see more people being curious about getting maybe their undergrad at TRU, which is an easier way to go about that. So yeah, hopefully people just keep growing.
Yeah. The yeah. What are your thoughts about having a bachelor's of science or bachelor's of health science degree as kind of like the entry level point for massage therapy? Is that something that you're for or against?
Hmm. I've thought a lot about that. Um, I'm not sure. I think where I would settle with it would be like a 2-year associate's degree would be maybe the more appropriate way to go. And like still getting a really good foundation. I'd like to see more physiology, like getting into second year level physiology, to be included in our program. But to make it, accessible, it's like, yeah, you can do 2 years of study and then start working, but maybe then you can sort of work your way up, similar to social work,
That
that
makes
kind
sense. That's a
of way.
good, actually, yeah, that's a great idea.
Yeah.
Yeah, I've not thought of it that way. I've always thought of it as like an all or nothing. Like keep
Hmm.
it as diploma or get your degree, but having that the 2 year kind of associate degree would be kind of a bridge that would be very possible.
Hmm.
Because those credits would be in a university or a college that would be transferable a lot more a lot more recognized than the current system with the private practices or
Yes.
the private
Yeah.
school. So yeah, I like that idea a lot. I think that because a lot of people are just going to, I want to go to school 2 years, I want to work. And then, how do you know, let's say you go to school when you're in your early 20s, how are you going to know what you want to do in your 30s and 40s? And maybe you're not going to want to be a full-time massage therapist working with clients. Maybe you want to do other things. That will
Yep.
give you an opportunity to try and expand and do other stuff. And
Yep.
I think that's a fantastic idea. I guess the key with that would be we'd have to get things out of the really out of the control of the private schools.
Yeah. And I don't know anything about sort of the motivations
Yeah, I don't
around
know either.
there. So
That's a topic for another conversation, I
yeah,
think.
absolutely.
Yeah, for sure. Yeah, digress here a little bit. But I like what you said though too. You mentioned second year physiology or more physiology. I have my thoughts on why I think that's important. What are your thoughts on what would that provide massage therapists?
I think it gives you a little bit more context for critical thinking, honestly. Like when I'm just out in the world and I hear claims about health, I have a background that makes me go, that doesn't sound right. Or like based on what I know about how the human body functions, like that doesn't seem like it's possible. Um, and maybe just gives you a little bit more context about how things work, I think.
Yeah.
Yeah.
Yeah, I feel the same way too. I feel that in our massage education, we learn so much anatomy and physiology and people, it's a lot of information and it's
Yeah.
very detailed, but I feel that the stuff that's detailed and is stuff that doesn't really matter. You spend a lot of time learning like attachment points between little tiny
Right.
muscles that have no relevance to anything. You learn about all the systems of the body in like learning about cellular respiration and stuff and these things, which is I think is really cool, but you don't really learn you kind of learn, at least my experience, and then when I talk to others, you learn this information and then you're like either like it's okay, it's great, it's information, it's interesting, and you never think about it, you never use it. It's not applicable,
Mm. Hmm.
right? But then you learn a lot of stuff and then you're taught, well, this is how you can fix these things with your techniques.
Right.
And I feel that there's a gap there in that
Huge
knowledge
gap.
between what's actually happening physiologically when we put our hands on people. You don't really learn. Like you do, but it's not, there's no science. There's no evidence to support a lot of that stuff. So I agree that if you actually understood, had a good level of, not graduate level, but a second or third year level university understanding of anatomy and physiology and how the body works, more a step above what we learn in massage school, a lot of those health claims or kind of mechanistic claims or things that people like to talk about in massage just wouldn't make sense. You're like, that doesn't make sense.
Yep.
I can't increase your circulation by massaging your skin
Yep.
because we understand how the venous and the circulatory system and the allostasis and all these things, balance everything out and blah blah blah. We understand how the kidneys and the liver and all this stuff works at a different level.
Hmm.
That stuff wouldn't make sense, and it wouldn't even be an issue.
Yep.
Yeah.
Yep. Yeah. Although, yeah, yeah, and I think like in addition to sort of that physical aspect, we really need to understand how people function and how they feel and like how they interact with people. Like there's that whole side of things too, and I think that because that would debunk a lot of the like, oh, we can do so much with our hands, is like recognizing how much else affects people, um, you know, beyond that.
Yeah. And that's one thing too that is not commonly addressed in a lot of our education, whether it's in school or in other CE courses, is it's very focused on technique, 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 right? I was just spent the morning kind of going through a lot of social media stuff and just reading some things just for my own interest to see what are people talking about. And
Mm,
it's all about what technique should I learn or
right.
what's the best technique to do this. And everyone's talking about techniques. They're not talking about, how do I help this person who's suffering with, I don't know, severe osteoarthritis of the neck. It's like, what techniques can I use to help this person with a neck? And I'm like, well, should you not understand about like maybe some of the processes involved and the experiences involved, and maybe it's more, maybe you should just take your focus away from your hands and like how can you support and work with the human in front of you? Because
Mm-hmm.
that's going to be more valuable. But we don't, that's not something we really learn. And I think when we have those conversations, what I feel is a lot of times when we talk about how we communicate and how we interact with people and the whole clinical encounter, it's sometimes think people think we're working out a scope of practice. Oh, we're counseling them, No, we're just working on mechanics. I'm like, no, you're working with a human,
Mm-hmm.
and that's something that definitely needs to be better understood. And we probably, it sounds like we're on the same page. That stuff should be entry level to practice, at least at the basic fundamental concepts.
Well, yeah, it's wild. We're working with human beings, like, and we don't have, I think we talked about active listening in passing for 5 to 10 minutes in my training, and we didn't even do any practice exercises. Like, it's like, here are the concepts of active listening. It's like, no, we're working with people. Like, how do we not focus um, on that more? And I get that maybe it feels really nebulous, maybe, and no one's taken on that challenge to be like, okay, let's break it down, let's make a framework for what that looks like. Um, Instead, it's just this big open gap that no one knows what to do with, I think. Yeah.
Maybe your implementation science training could help with some of that stuff.
Yeah, that would be an interesting approach to take.
Yeah. What did you focus on in that aspect of your education?
So that was just really learning about breaking down implementation science into its like understanding what it is for one thing. It's a very structured approach to problem solving, and it's looking at, so you have a situation, you understand what the current approach to a treatment or a policy or something like that, and then you go, okay, well, there's a better way to do it. Maybe it's more cost effective. Maybe it just has better outcomes. Like, um, there's some benefit to it, and you go, okay, why isn't it being adopted? And so you want to identify what the barriers are, what are the things that can help implement it, and then come up with a plan to deal with those barriers. And then, of course, a huge factor in it is monitoring and evaluation after, is like, how well did this go? Like, did our plan work? That sort of thing. Yeah.
Yeah, that's a good point that you make there because I feel that a lot of times there's policies or things that are put out there or implemented, but there's not that evaluation of like, did it have the desired effect?
Yep.
Right? And that's good. I mean, part of what I did when I was doing my master's degree was we did stuff on like it was a lot of focus was on knowledge translation.
Hmm.
So, how do we, what are some of the best strategies and ideas to translate knowledge into practice? But the last part of that was you couldn't just give people knowledge. You had to see if it was actually working. Is it actually changing their practice? But that's
Yeah.
the stuff that we don't, as clinicians and even in our like kind of CE world, you don't really know if it's actually making a difference
Right.
because you have to ask the evaluation afterwards. So that's a really important thing, which, and I'm glad that you were able to do that. It sounds really fascinating. But
Yeah.
anyway, before I digress too much,
Yeah.
uh, what do you think? So you did your master's degree.
Hmm.
Fantastic. Congratulations. I think that's great. And add your name to the list of growing a growing number of RMTs with higher level education. I think that's fantastic. But what was your rationale for it? Like what did you want to do with it? Like how do you think it's going to what were your plans for that to how it was going to impact your future?
I wish I had like a really clear answer for you on that one, but I was just curious. I was looking for more information. I was looking to grow. That was sort of my sense. And I was like, what does my future look like? Do I want to move into more a decision-making role, policy role, something like that? But what I came out after the program was I just recognized how much more confidence I had in like looking at information and synthesizing ideas and feeling like, oh, I do have something to say about this. Um, and it made me recognize too, I think what's so important about education is that you realize like the more that you know, the more you realize you don't know. And I think that is so important, even in um, our profession, to just have people maybe be a little bit more humble with information and be more careful with it. Um, so I'm not sure where it's going to go yet. I think things are still percolating, but I feel like I just have the confidence to go forward.
That's huge.
Yeah.
Having the confidence and feeling better about that. Do you feel that it changed your practice at all, like how you treat or work with patients every day?
Mm, a good question. I think I think what I have noticed recently is like really wanting to empower people. Like I want them to have the information too without overwhelming them. And I have to watch that too. It's like, when is it appropriate too? Um, but yeah, like I want people to feel like they understand their bodies better, and um, even if they're not working with me, so that they can make better decisions. I actually sent the webinar you did for the renal foundation, or
Oh yeah, the Kidney Foundation in
yeah,
Atlantic Canada. Yeah.
because I thought that was such a great little concise little thing of like, here's what manual therapy does.
Oh, good. Thank
And
you.
I want people to be like, oh, okay, well then how does that translate into what other kinds of care that I would get? So um, more informed, more empowered.
Yeah.
Yeah.
Yeah, that's fantastic. That was the reason I asked is because when I was doing my degree, that was a question I got all the time from people. Well, what difference is it going to make?
Hmm.
Like, are you going to charge more? I was like, well, no, I'm going to charge the
Yeah.
same as whatever everyone else in the clinic in the region is charging. Well, then why would you do it? And I felt that for me, when I went and did my master's degree, it was I'm not gonna say probably, it was definitely the best professional decision I ever made.
Mm-hmm.
'Cause I felt that, so clinically, I felt more, like you said, more confident, more comfortable. Like I felt like uh, I was definitely gave me an understanding that I did, like you said, I didn't know a lot, but I knew what I didn't know and I knew what I did know. So it gave me that sense of humility of like, yeah, that's a good question, but I'm going to help find you the answers.
Yeah.
That kind of attitude was definitely, um, I definitely got from that, and it was. I felt more comfortable too in making suggestions to people or having those conversations with people when they were like, "Well, what should I do? What's the bet? What, like, this isn't working. This isn't working. What are my options?" And it gave me, and because of what I was studying, it gave me a lot of. I'm like, well, here's some papers. Here's some things I've read. Here's kind of some of the least wrong maybe potential solutions or management strategies for you. So I felt like, yeah, the knowledge helped. Didn't really change much with what I did with my hands,
Yeah.
but it definitely changed a lot with how I interacted with my patients, I felt. And then also too for my CE aspect, my CE business, it was hugely beneficial for that because I got to spend 3 years just reading papers and researching all the stuff that I wanted to, and then I could use that to build, inform the content for the courses. So it was great. And if anyone's listening and they feel that, is it going to make a difference? You don't really know until you try,
Yeah.
and it's opened up so many doors for me, like so many doors of different things I never even would thought of doing. Working with curriculum development at schools and working with colleges and associations and being able to present at conferences and speaking at universities and things that never would have been an opportunity before,
Yeah.
but that you have that piece of paper which says you did the work, so
Yeah.
therefore it opens up a few more doors for you. So I think it's something that is really worth exploring if anyone's into it that's listening.
Yeah, for sure. And I think even being a confident voice in someone's life who is maybe experiencing pain or recovering from injury too, and being able to say, yeah, you're going to be okay, and let me help support you find the best way for you forward. Um, I think is just such a great influence, rather than maybe someone who's like, okay, well, we need to solve the problem this way and this way and this way, who might be a little less confident um, in understanding how all of that works.
And that's a thing that is a big shift in thinking, I feel, for our profession, and not just us, but any MSK profession, is moving that shift from I got to focus to fix and try all these things to how can I best support you on your journey.
Yeah.
And that's not a typical conversation that we see a lot of. We see more of it now than 10 years ago, but it's still a long ways to go because I often think patients or clients come to see us and they expect us to fix them.
Yeah.
But I see there's a lot of danger though, and I saw this all the time in the chronic pain population that I treated. Anybody, but particularly that population, is when you've had a number of therapists trying to convince you or to sell you a wellness plan, or like this is what you need to do, and you go and you spend months or years in some cases and thousands of dollars of either your own money or insurance company's money trying to fix a problem,
Yeah.
and then they end up just the same or worse because the focus was on the problem, not how can we support the person. That
Yeah.
subtle shift I find is massive because it takes the pressure off you trying to fix, and it creates this more uh, relationship between you and the other person where you're there to support them and like help
Yeah.
them make decisions. And your massage is part of it, but it's not the fix.
Yeah.
And one thing I always say to people is that the danger when you make big promises to clients or patients is that if you don't live up to it, then what are they left with? They're left finding somebody else
Yeah.
who's going to make big promises, and they keep on chasing and chasing and chasing, and you get on this healthcare professional wheel. It just keeps spinning where you see all these people and you're going nowhere.
Yep.
Yeah.
Yeah. And I would say that's analogous to, and I experienced this early on in my career too, of like looking for the next technique. Like in thinking, oh, other people are helping people better than me. What's the next technique I need to learn? And you end up on that hamster wheel trying to find the right thing to do, um, just on the other side of the table.
For sure. And I did that too early in my career for sure. And I wish I know I think I've said this probably numerous times, so people probably who listen to this podcast regularly are like, yeah, Eric, you keep repeating yourself, but I'll say it again. For me, it took me longer than I'd like to admit to realize that I was mistaken, like I was wrong.
Hmm.
Because I got heavily involved in like structural integration and myofascial stuff because it appealed to me.
Yep.
And I'd had those kind of treatments and they helped for me. So of course I need to learn how to be as amazing as everybody else. And then it took too long, but I realized after quite a few years, I was like, this doesn't make any sense anymore.
Yeah.
I wish I could have noticed that earlier, but we get hype, we get hyped up on those things, and
Yeah.
it's attractive because
Yeah.
they make big promises.
Yeah. And when you're not learning anything different, then what are you supposed to do? I remember in our program, someone brought up the point, okay, well, if we're giving people home care and saying like this is what you need to do, and they're not doing it, what do we do? And the advice came back, oh, well, all you can do is just keep telling them over and over and over until it clicks. And it's like, you know, or maybe you think, this might not be appropriate for this person, or like, what's another option? So I think that's a new thinking that I'm so glad to see is coming forward. But on the other side of that, I have seen it sort of swing the other way, where it's like, oh, well, it's no longer my responsibility to fix you. It's all on you. And
Yeah,
if you're not going to do the work, then you're not going to get better. So I'm like, let's come back to the middle here. Like,
yeah, that pendulum swings pretty far both
yeah,
directions. And yeah, when I was in school too, I remember learning that what you said about just you got to just keep telling them, just got to keep if they're going to get better, they got to do their stretches, they got to do their exercises, and and now I look back and I kind of laugh and I think the amount of rehab stuff that we got educated about was terrible. It was
mhm,
all very like passive stretching and just like very linear like strength training. It was so ridiculous, and it was just like do this many sets, this many reps, repeat this many. It was so poor, and
yeah,
I think a lot of places they still do that. And yeah, and then now you see the shift where like, well, just it's up to you. I can't fix you, so you got to take care of yourself. And I'm like, no, it's supported self-management, which means you help the person, you know,
yeah,
find things that they can do on their own. And I know when we have these conversations, it can seem kind of vague, kind of gray, like what are we talking about? But clinical practice is gray. There's not a lot of answers. There's just a lot of kind of less wrong ideas that you can kind of play with.
Yep. Yep. Yeah. And how do you get that? Really, I think switching to the idea of function is like, what's going to make this person's life enjoyable, worthwhile, like functional? And if that's the question you ask, rather than, oh, how do we get rid of this person's pain? Um, then it would totally shift how we approach people.
100% it would. Yeah, because how like pain. I mean, how often can you just say, "Oh, I'm going to get rid of all your pain"?
Yeah.
If someone's been in pain for a long time, maybe you can turn the volume down a little bit on their pain experience, but you're not going to get rid of it.
Yeah.
And everyone's probably has a case where someone's been in pain for 10 years and you did something and then they got better.
Right.
And you're like, I fixed them, but
How did I do
that's
that?
like that's like one in 1,000.
Yeah.
It's not good odds. But we always remember that one. We always remember that one person who had pain forever. We did this one thing and they got better.
Yeah.
But that's
Yeah.
not the majority.
Yeah. No, life is painful. There's no way around that. Yeah.
Yeah. But function is key. And I mean, because I think in MSK world and in our massage therapy world, we can help people with function, hopefully more so than we could. I should say hopefully, but we have a better claim of helping people with function than we do of reducing their pain significantly. We can modulate pain for a short period of time during and after massage, but long term, the evidence is not good.
No.
Yeah, it's very short term. So, but function is something, yeah, and we see that all the time too, right? If you look at, and this is gonna segue into our next conversation about evidence-based practice, but we see that a lot in evidence-based practice stuff is that you know, getting people to function better is a more reasonable and more supported goal. And like all the clinical practice guidelines are focusing more on function rather than just 100% pain relief. It's pain modulation, pain control, not pain elimination. And the
Yeah.
goal is always function.
Yeah. Yeah. It always in service of getting back to things that you love. Yeah.
Yeah, yeah, for sure. So just as we kind of move into our little conversation here on evidence-based practice, I just wanted to ask your opinion on what do you think some of the biggest issues are that our profession is facing today, and let's put that within the realm of evidence-based practice.
Yeah. I think given the new standard that just came out, I think a big challenge is going to be that transition. What does that look like? How are we going to have different conversations? How we move through this transition is going to be a big challenge, I think, for a lot of people. But I think there's so many opportunities for people such as yourself to provide resources and support and information in a really supportive way to help us move forward.
Yeah,
Yeah.
yeah, that's a good point because I mean, there's many issues facing our profession in BC, the college amalgamation with the other, what are they
Mhm.
calling it? Complementary or integrative health?
Oh, now I forget.
I
There's
forget.
some others.
I know a lot of us wanted to be in the allied health one, but the allied health college is all basically university degree colleges or
Yeah.
university degree professions, and then the one that we're in, which I can't remember what it's called, is all basically just like trade school, like private school kind of stuff, right? So it's naturopaths, massage, chiropractors, uh,
And Chinese
Chinese
medicine.
medicine, acupuncture. Yeah, so those ones are all in that college. So that'll be interesting to see how that goes. I don't know if it's a big issue, but I know it personally. I'm not too concerned about it. I don't. There's nothing we can really do about it. But I think a lot of people in our profession are like freaked out about it, and I think
Mhm.
it's a bit of a slap in the face. I think for those of us that are kind of evidence based or science based in our thinking, it's kind of like, oh, now we're going into these other professions which maybe we don't identify with, but
Right.
that's
But I think there's movement in those other professions too, similar to us, where there's like subsets of people who are pushing for a more evidence-based approach. So maybe we could all sort of work together in that direction.
Yeah, and that would be a great solution because
Yep.
we can talk about problems all we want, but solutions are, I think, are the key thing. And I talked about that in a previous podcast episode that I released about just like some of the options for solutions, right? And there is options out there depending on what it is you're looking for.
Hmm.
But yeah, there is. I know a handful of chiropractors that are, they don't like the direction that their profession has gone, and with like the kind of before, a lot of the chiros were doing the x-rays to, pathologize your spine and then selling you a series of treatments. And, I know that stuff's been kind of taken away and there's a huge pushback on that. So there is definitely an evidence-based contingent to all the professions,
Hmm.
but this might be an opportunity for them to get together, hopefully, and push for better. So fingers crossed,
Yeah,
right? Fingers
yeah, that's right.
crossed. Yeah.
Yeah, that would be another big issue though, is I think we kind of need to, identity is a big one for us, and I'm sure that's been mentioned before on your podcast, but um, I've even noticed it's like when we were talking about the name of the new college and like how people want to be considered, be it complementary or integrative, or it's like trying to figure out how we relate to um, the healthcare system. Are we something separate, or are we a complement? Are we a support? I think that's a big thing that we'll work on as we move forward.
I think from the conversations I've had with a lot of RMTs that they would love to be part of a full healthcare system, kind of like how physiotherapists are or
Mhm.
occupational therapists are, or even opportunity to work in a hospital or an outpatient care, or you could work in private practice. Like there's more options. And I know a lot of massage therapists would like that. And I think it'd be fantastic if our profession could get to that point. But I think we're saying at the beginning of this podcast, without that entry level education being higher without having a degree, it's just probably not going to happen just in
Yeah.
terms of how we are perceived by the public
Yep.
and how we are perceived by the healthcare world.
Hmm.
And to be honest, when we look this on a lot of the nonsense that's out there, a lot of the pseudoscience that is really common
Hmm.
in our profession, that really holds us back
Yep.
because it's like it's not helping.
Yeah.
And so hopefully with this new evidence-based practice standard, which we're going to talk about here, the hopefully that'll kind of help to push us in the right direction where there won't be it won't be tolerated anymore by our regulator.
Hmm.
And it's that you can't say and do things that are not evidence-based. And there's no, and this is a thing too, I guess we should say just some people I know, and I like the term science-based because it talks more about biological plausibility. But I think in terms of where the college is going with this, I think evidence-based is a good start.
Yeah.
So I think that just wanted to put that in there for those who are like, I like science-based. Well, I like science-based too, but let's go with a term that's been used for a long time. So
Yeah.
evidence-based. But and it'd be interesting to see how this how if this has any teeth though. Like, can they
Hmm.
do anything with like are they going to actually say no? Like you can't have those things on your website. Oh, we've had these complaints from the public where you've been saying or doing these things, and that's actually not evidence based. It's your responsibility to understand what evidence is for what you are treating, and also to I'm hoping, and I don't. This is a big hope too. Is I'm hoping that it will really influence the type of continuing education or quality assurance that massage therapists pursue. So that way they're going to have to say, okay, well, if I want to take this course, is this evidence based? And what does that mean?
Yeah.
And that's the question is like you could take anything, but is it going to satisfy the requirements of the college to take?
Hmm.
I don't want to throw any names out there, but to take a course that is not evidence based.
Right.
And then the problem is, I think that we're going to have those. I think we're going to have instructors be like, "Oh, it's evidence based," and then they'll throw down a couple studies, and and
Yep.
you look at the studies, and they're probably totally irrelevant or they're
Yep.
crap science.
Yeah.
So there's going to definitely that's going there's going to be a bit of a learning process, but I hope that the CMT will be able to have some teeth in saying, look, that's not okay. This is how we have to improve. So they're gonna have to have some good quality resources and maybe some audits or something's going to have to happen to see how that all plays out.
Yeah, and that's the thing is like policy is one thing, and then having the support to implement it successfully um, will be the big thing there.
Hmm.
Yeah.
So what are your thoughts on the new standard?
Um, I wish we had like a little celebratory party, but I think it's a pretty big deal, honestly.
Yeah, me too. Yeah.
Um, but I think it's great, and I think there were some statements in the actual verbiage of it that were really, I think they took a really strong stance, honestly, about like thinking about how what you say to clients, like how is that going to affect them? Like this is really important stuff to consider. So I think it's great, and I'm really interested to see where it goes.
Yeah, it's still too fresh. It starts it'll already be in place by the time this podcast is live, but as of today, it hasn't actually taken effect. It takes effect on January 15th.
Mhm.
So a few days from now. So yeah, it'll be interesting to see what actually happens. But I agree. I think we should have had some kind of party because I think compared to the only other place I think that has an evidence in their standards is in Ontario, but they use the evidence informed and it's quite watered down and
Yeah.
it's not nearly the same. It's not nearly as strongly worded as BC. So we should really commend the college
Yeah,
and the people there
absolutely.
that put this through.
Yeah,
Yeah. Did you want to? So let's talk about your kind of 10 tenets of evidence-based practice because we had a conversation I don't know maybe a month or two ago and you had come up with this and I thought this was such a great idea. Did you want to go through and kind of list off those 10
sure.
just as a learning opportunity for people that are listening just to see
Yeah.
what it
And
means?
just to put it in context too, I like when I'm thinking about concepts and I'm trying to sort of solidify them for myself. I love frameworks. Um, I just started scribbling down. I'm like, what would be kind of like the essential things you need to focus on if you want to grow your evidence-based practice? And so I just started doodling these things down, and this is what I came up with. So if other people have ideas or things they want to add, yeah, let me know. Or add them to your own little reflective piece. But I'm hoping this could be a tool for people to sit down and think, oh, these are little areas that I can improve upon, or be interested in. So let's just go top to bottom here. So I've broken it up into 3 sections, and it's kind of those three stool legs, is it, in the evidence-based practice um, model of, so I've broken it up into one, like how you relate to information, how you relate to patients, and how you're relating to yourself. And so we'll start at number 1, which is develop the skills to search for and evaluate reliable information. Um, and then I've put little subpoints under of do not make assumptions, ask questions. Number 2 is stay up to date with current pain science, health research, and best practices. 3 is do not spread misinformation. And I've put under that, evaluate claims and sources carefully before sharing, and know the dangers and harms of false narratives. Number 4 is be aware of various resources available for patients in your community and online. And then if we move into the relating to patients piece, it's 5 is know your role. So who are you to this patient? And there's a book out there. It was for physios, but I've pulled out some of the titles that I thought were kind of great of being a confidant, being a coach, a detective, a teacher, but not a healer. So we're a support person, not a fixer. And then under that, B is know the mechanisms of action for massage along with realistic goals and outcomes. Number 6 is know your limits. So knowing how to identify red flags and referring on is under that. And being comfortable saying, I don't know. Okay, moving on to 7. Be patient-centered. So learn how to determine and support the patient's values, beliefs, goals, and preferences. Number 8 is pay attention to your communication. So learn how and when to share potentially helpful information in a supportive way. And B, know the effects of language and other communication on the therapeutic relationship, that person's pain and disability experience. And then when we're thinking about how we relate to ourselves, 9 is develop regular reflective practices. So A is understand your motivations, your biases, strengths, and areas of growth. B, be curious about your emotional experience in the process of transference and countertransference. C, get support when you need it and regularly discuss cases with colleagues. And then finally, number 10, commit to constant improvement. Continue to learn about pain, rehab, healthcare, disease processes, communication, yourself, research literacy, and appraisal. So those are my 10 rules.
I love it. I love it. I think that's such a great way to kind of put that all together. And it's, these are things that are, we should all be able to do. And you could read it, it's like, oh my gosh, 10 things, but these are not impossible.
No. And they all interplay as well.
Yeah, there's so much overlap between them, right? Which is evidence-based practice as well. There's an overlap between, what's the relevant research evidence say versus your clinical expertise versus the person and the context of the environment, and
Mm-hmm.
and they all kind of overlap together. And so this is fantastic. So maybe I will, in the show notes, I will put a copy of this
Yeah.
with your
Yeah.
name on it, so so people can have a look at that. I think it's really useful.
Yeah. Because I just think it's so important when we're moving forward with something to have tools to fill that gap of like, well, what do I do? Well, here are the things you can work on.
And when I read this too, this kind of goes into another conversation we've had before, and we can wrap up the podcast with this little conversation is the idea of patient safety
Mm-hmm.
and making the person feel safe. Because when we look at how this evidence-based practice stuff is, if we look at understanding the pain science and we look to not spreading misinformation, we look at our role about being more of a coach or a detective and not a healer. Knowing knowing the science and the knowledge, but how to identify red flags, saying I don't know. A lot of the stuff you can put into this idea of like just of safety, of making the person feel less threatened, less
Mm-hmm.
broken.
Yeah.
And I know that in the idea of safety is some people don't necessarily agree with that, and we're not talking about pain science or pain splaining. We're not talking about like neuroscience education where you're like, I'm going to tell you everything that you need to know about pain to make you feel safe so you're not feeling threatened by what's happening in your body. We're not talking about that kind of safety, because that's an idea that's popular, and I used to teach more of that. Now I think I try and do a better job of putting that pain science stuff into proper clinical context.
Mm-hmm.
So you're not just pain splaining. But I think I still strongly believe, and when I look at the evidence and we look at kind of your comments here, if our goal is just to make the person in front of us feel good,
Mm-hmm.
can our touch feel good? Can our clinical environment feel good? Can our words feel encouraging?
Mm-hmm.
It's not just being like, oh, I'm so nice, blah, blah, blah. It's not like over the top, but it's just everything we do is how can we support you? How can we make you feel like this is a good place to be?
Yeah. Yeah. And a little metaphor that I sort of, after thinking about these things and what it is that people really need from us, and I always think like we're really adults or just bigger kids. And at the end of the day, like this is going to sound a bit reductive, but in a way, like we're professional boo-boo kissers, right? It's like,
I love that.
how do you be the best possible boo-boo kisser that you can be? How do you, because someone hurts themselves, they come and they say, I have an owie, and you say, oh, you're gonna be okay. So reassurance, right? And then you provide some sort of care touch. that's going to support that person. So how do you create an environment that's super supportive, super safe, and you're going to create that resilience and that empowerment for that person? Um, and you're not saying, oh, I'm going to do some magic to it and like fix you. You're just saying like, do you need some information right now? What do you need to feel like you can go forward confidently?
I love that.
Yeah.
Professional boo-boo kissers.
Yeah.
A lot of people probably be very offended by that, but that's okay.
Oh, I guarantee.
I love that though, and it's okay because I think we should be able to laugh at kind of what we do, but that's so true. And
Yeah.
and you use the term reassurance, which is important because if we look at the clinical practice guidelines for pretty much any MSK condition, it's like reassurance is usually the first thing.
Yeah. And
Yeah,
that creates safety. You're going
and
to be
that
okay.
creates safety.
Yeah.
Yeah,
Yeah.
yeah. It's usually reassurance, education, and then usually some type of, depending on what it is, some type of touch or movement
Yeah.
within comfort and tolerance. Like it's usually pretty basic, and you can apply those principles to pretty much any MSK condition you'd see. Uh, Obviously, you don't want to reassure when it's a red flag.
No, no.
So you can't, yeah. And that's the thing. I think that someone said that to me once before. But what if, it's this? I'm like, well, that's when you're not reassuring. If the
Yeah.
person has like bowel bladder dysfunction and saddle anesthesia and they've had a low back injury, that's a red flag.
Yeah.
Don't reassure them and say you're going to be okay. Don't worry about it. It's not that. Yeah, it's not that. It's not for every situation, but I would say 90 was the data. It's like 96, 97% of all MSK things are kind of benign anyway.
Hmm.
It's very rarely to something serious. So more often than not, if it's something serious, you're probably going to know. If it's
Yeah.
not, you can reassure them and give them a nice boo-boo kiss.
Yeah.
I love that's great. Well, thanks, Nadine, for being here. This was really fun. I really enjoyed this conversation, and we have some other. I'm sure we have lots of other things we could talk about, but maybe we'll get you back on again in the future, and we can maybe see how this standard of practice thing played out, and have uh,
Absolutely.
another revisit that conversation. So, did you want to provide your contact information for anybody if they want to have any questions for you? It's the best way for
Yeah,
them to get in touch with you.
I'm wondering, yeah, I was asking myself that question before, but I think probably LinkedIn's actually the best way to get me right now. Just search for my name, which would be in the show notes, and connect with me that way.
Perfect. LinkedIn. Okay, Nadine. Well, thanks very much for being here, and have a good day, and we'll talk soon.
Thank you so much.
Thank you for listening. If you enjoyed this episode, please give it a 5-star rating and share it on social media. You can follow me on Instagram or Facebook at Eric Purvis RMT. And please head over to my website, ericpurvis.com, to see a full listing of all my live courses, webinars, and self-directed course options. Until next time, have a great day, and thanks for listening.